Two of the reasons why Black women are more challenged is not because there's any difference between Black bodies or white bodies or South Asian bodies. So I just want to make that clear.
Right.
But some of the risk factors that are associated with uterine fibroids, Black women tend to have more of.
Welcome to the Shan and Tam Show.
So welcome to the show today, Shan and Tam fam. We're always excited to be here with you, and today is no different. We have a powerhouse in our midst tonight, Amoy Jacques, and she's going to be speaking with us about a very important topic related to women and reproductive health.
Amoy is a kinesiologist and an expert in the field. We know that cultural norms tend to keep us in spaces where we're quiet on certain issues, we don't talk about it, and the shame and guilt of what we're experiencing holds us in a place where we don't seek the help that we need. So today, Shan and Tam will be breaking down another barrier and talking about a very important issue in our Women's Health series. Let's welcome Amoy Jacques.
Amoy, welcome. We are so appreciative that you took the time to be with us this evening and on this platform where our hope is that we inform, educate, and advocate not only for ourselves, but for all our viewers. So we appreciate you and we welcome you.
Thank you.
So, Amoy, you're looking so beautiful this evening. And I know we spoke a little bit about your bio earlier, but we just wanted for you to just give us, just tell the viewers, tell us a little bit about yourself.
Okay, so my name is Amoy Jacques, and I do wear a lot of hats. My first hat is I'm a registered kinesiologist. I've been with the University Health Network for over 12 years, and my role there is to work within an interdisciplinary team to create exercise programs, do functional assessments for the injured worker population,
Okay.
and also to ensure that they have a safe return to work.
Mhm.
Embedded within that work is health promotion, advocacy for better care for this client population, and also working alongside surgeons and physiotherapists, occupational therapists to make sure that we're making the right care and pathway for the client. So that's one hat. Another hat that I wear, I got my master's in public health in 2018, and I'm currently a public health researcher as well. So I am working on a research project to look at the experiences that Black people have around endometriosis and fibroids. Women's health is a second passion of mine, and so that's another hat that I wear.
Okay, that's good. You're well-rounded, Amoy, and I know you have more hats that you're probably
yes.
not
We'll get into that.
Yes,
for sure.
So from all that you said, it would appear and it would seem that women's health is very personal for you, and it's a very personal topic. So can you speak to us a little bit about how your early upbringing has informed your journey and the direction that you've taken professionally?
Yes, for sure. So, I grew up in a household with a lot of strong women, and I know that's very common within the Black diaspora. And so growing up in Jamaica, I had my grandmother and my aunts, in addition to my mother, to raise me. And from their leadership and mentorship, it really has groomed who I am today. And I've always benefited, and God has always placed women in my path to kind of guide me along the way. So I do see the benefit of that, of women helping women. And so that has always been a common thread in my life. And also from a health perspective, growing up, I struggled a lot with heavy periods, and within the Caribbean, we don't talk a lot about some of these health issues that we have, and it's unfortunate. We're starting to see that tide shift, but growing up, I just didn't have an outlet to share what was going on below the belly button.
Right.
And when I got to university, I struggled a lot with heavy periods for a very long time. And I thought it was normal because no one was talking about it. And I remember one day I was actually on an exchange program in England, and I collapsed on a bus, a double-decker bus, because I actually had fibroids and I didn't know. And so when I came back to Canada, I got diagnosed with fibroids. This is at age 22. And it's been a very long journey of just understanding the disease and why it affects so many women, particularly Black women, in such a grave way. And it's become part of my journey. I think just this year, I've just finally accepted that this is who I am. This is part of my story. And it really has been the catalyst for a lot of the work that I'm currently doing.
Okay. Well, Amoy, you know what, just listening to you, my heart, because I know that a lot of women don't feel comfortable, and it's so empowering when you can really just speak and, you know, just own your story and own what's going on without the shame. Right? And we applaud you. We applaud you for all that you're doing and for even being brave to talk about it and the impact that you're giving back to society. But I know that along your journey, a lot of people must have motivated you. What has been that driving motivation for you to now talk about these health challenges?
Yeah, you know, when I think about what has motivated me, it's come from a lot of different angles. So, you know, I would say my mother definitely has always been one where I can share my concerns. And even though she's a very private person, she actually got to the point where she said, you know, Amoy, you do need to share your story because it's quite compelling. And I do have a group of friends that have rallied around me to support me, because having a support system, especially when you're dealing with a chronic illness, is so important, because you go through so many changes, you know, physically, mentally, emotionally, and having people there that understand you outside of your illness is very important. And I'm gracious and grateful to have that network of people to really motivate me. But, you know, on a deeper level, it wasn't easy to share my business publicly and even on my website. But, you know, as an advocate, and I own that title now, because when you advocate for people, you actually need to walk their journey. And so it wasn't until I was able to fully accept my story that I said, you know what, this is going to motivate me to share my story so that I can better advocate for other people that don't necessarily know the healthcare system or don't necessarily have the same support system or graces that I've been afforded to. I do recognize that I have a lot of privilege because I'm educated, I have a support system, I kind of know how to navigate the healthcare system. And so based on all those things, that's what's motivated me to, you know, bring this project to life.
And, you know, I can understand from that helping place, because I feel like if you're the type of person that wants to help, there usually is that drive for you to break down those barriers to kind of put yourself into other people's situations, or to let them sort of relate to you on a very personal level. So I can understand your need to be open about it, you know, because one of the things that we often talk about, like Shan and I, is the fact that we sit so much in the shame that we have around our circumstances, because we feel like we're the only ones, right?
Right. And throughout my journey, I can't tell you how many women have come up to me privately to say, oh, I have fibroids too. And they're, you know, kind of whispering and, you know, wanting to meet with me privately. And the shame is huge, you know, and that's something that we carry. And as a result of shame, it silences you. And it's important that we share these stories in spaces that are safe, like a space like this platform, where people can feel that, you know, one, you're not alone, and that there is help out there for you, and that the moment that you can take that first brave step to just open up your mouth, that there's a team of people that are more than willing to help you. I can say that sharing my story has catapulted me in a different level that I just didn't think possible. Like meeting with doctors and stakeholders, and now having a research study has been built from sharing my story. Like I start by sharing my story when I meet with someone that I want to be part of the team, and it really opens up the door for an honest and open dialogue, and also a space to show that because we don't have this data within our healthcare system, and I know we're going to touch on that later, it's hard to really understand or humanize the persons behind the numbers. Sometimes we get caught up in the statistics and we don't understand the journey of the patient that's actually walking through these challenges, when they have to meet with their doctor or have another diagnostic test. And it's so important that we, in addition to the data, that we actually see the people that are going through what they're going through.
Absolutely. And you know what, Amoy, just listening to you, I can say that your purpose was birthed through this situation.
Oh, yes.
Because you are just meeting with people and speaking with people and empowering people through your story. And, we just want to applaud you and just speak life into you, because it is truly a journey. And I know that Black woman of color, you're passionate about that as well. In terms of the reproductive landscape and the context in Canada, can you speak a little bit about how this impacts Black and Indigenous women?
Yeah, definitely. So, whenever we talk about the landscape, it's important that we look at the historical lens. So oftentimes when we talk about slavery, I know it's usually relegated to the States and the Caribbean, but Canada has a very sordid history when it comes to slavery. And when it comes to Black bodies, particularly Black women and Indigenous women's bodies, and taking advantage of them, and, using our bodies as a tool for whatever economic advantage you need. So we have that history here in Canada, unfortunately, and we do see it play out in a number of ways when it comes to the lack of data that is collected on understanding some of the reproductive health challenges that we go through, and having a population level intervention to support the data. So for example, when it comes to uterine fibroids, which is a very common reproductive health issue, here in Canada, we have very limited data to kind of break down how it impacts white women versus Black women. We have data from the States, but we know we can't use that data because their mixture of Black people is very different. They don't have the same heterogeneous mixture that we have here in Canada. It's mainly African American. They have a sprinkle of, Indigenous African, but we have a more mixture of or diverse group of Black people. So Black Canadians, Afro-Caribbean, Afro-Latina, people from other African nations are represented here, but we don't have the data to actually show how the disease is broken down. And so as a result of that, we don't know specifically how the disease actually impacts this population in a very significant way. Like we have data from the States that I said, but we can't use that because the demographics is different, our healthcare system is different. And even when it comes to Indigenous populations, they have similar issues in terms of advocacy and experiencing, racism within healthcare. And so it creates a very challenging situation in terms of treating this special population. When it comes to other diseases like endometriosis and PCOS, it's very similar as well, where marginalized groups are underrepresented in the data. And so we see challenges with women being represented in research and BIPOC folks being represented in research. And the result of the underrepresentation is a lack of treatment, a lack of policies focused on these groups.
But why do you think that is predominantly so? Because we recently had another guest who spoke on the issue of uterine cancer and her experience as a caregiver with her mom. And it was a topic, a part of the discussion for us when she did point out to us, which we didn't know, that there is such a lack of research in Canada. And you just talked about the diverse nature of our country. Like, why do you believe that it's something that's yet to be addressed?
So there's a bunch of different reasons. So when you think about research, you have to think about specific areas that are getting funded, because it really comes down to money. If there's no money going into certain areas, then there's not going to be any research done. So for example, when you think about chronic ailments on a list, the top one is usually cancer and diabetes. We have major hospitals with foundations that are pouring in money for these areas because they're prioritized when it comes to research funding. When it comes to funding for marginalized groups, there's not a priority area. So I'll give you a specific example. So in the States, there's an agency called the National Institute of Health, and they're one of the big funders for research across the nation. So within their priority area, they have marginalized groups. They have a bunch of different priority areas that kind of breaks it down in terms of whether it's disease category, population category. So they actually have a category for marginalized groups. And so as a result of that, you can look at, let's say, like uterine fibroids in Black women, because you'll have like a pocket of funding, right? And we've seen, especially with Kamala Harris running for vice president, like she's recently asked for funding for uterine fibroids because through the NIH, they have a priority area for that. Right? So it's a system that's set up that specifically addresses this area and this need. When we look at Canada, so the equivalent to the NIH in Canada is the Canadian Institute of Health Research, or CIHR. So they are like the main research institute here, and we don't have a priority area for marginalized groups. So that creates a problem in terms of how funding is going to be funneled, because if you don't have a priority area for us, we're not going to be sitting at the table in terms of committees who are making these decisions, funding going towards marginalized groups. And another thing, so it's two challenges here in Canada. So there's the lack of priority area for marginalized groups, that's one. And then there is the lack of priority area for women's health research. Now we see that tide shifting, especially with agencies like Women's College Hospital, which is setting up specific funding for women. But that is a recent phenomenon. So it's going to take some time for us to see the uptick of more research for women for a variety of issues. So we're, essentially we're significantly behind here in Canada because of the structures that I've mentioned. And it really comes down to the systemic racism that is entrenched across all sectors, and a shift that needs to take place within how the system is structured to actually ignore certain pockets and uplift other pockets.
Wow, that is quite interesting. Yeah, quite interesting. And unless you'll be so like in the dark about the challenges, right, that Black and Indigenous and women of color face within this country. But can you speak a little bit to us, Amoy, on some of the reproductive health challenges faced by Black and Indigenous women here in Canada? Some of them.
Yeah, definitely. So I mentioned uterine fibroids. So when we take a look specifically at that disease, so uterine fibroids is basically a non-cancerous tumor that lodges itself within the uterus. It can lodge itself outside the uterus, and there's different categories. I'm not going to go into all the categories, but basically it can cause a lot of pelvic pain, pressure, challenges with fertility or infertility, and miscarriage. So we do see, and again, these statistics are coming from the States, that when you look across all populations, it affects up to 70% of women. So it's quite common across all races. But when you look specifically at Black women, we tend to have earlier periods, heavier periods, and multiple fibroids, and more pelvic protrusion, because the fibroid growth tends to happen rapidly because we're having our periods earlier, gives the fibroids more time to grow. So one of the reasons, or two of the reasons why Black women are more challenged is not because there's any difference between Black bodies or white bodies or South Asian bodies. So I just want to make that clear. But some of the risk factors that are associated with uterine fibroids, Black women tend to have more of. So that would be hypertension, diabetes, cigarette smoking to a lesser extent, and also exposure to something called endocrine disruptor chemicals, or the harsh chemicals that you'll find in like paint or hair dyes, or Yeah, so that's why this whole natural hair movement it's really a revolution.
Yes.
To kind of break that. I mean, we could have a whole discussion about EDC.
Right. Absolutely.
But so that's one of the reasons. When it comes to Indigenous, when it comes to fibroids, I don't have those numbers, so I can't speak to that.
Okay.
But we do know, because of some of the social determinants of health, racism being one of them, poor housing, poor access to care, that is also going to compound some of their health concerns as well, right? When it comes to endometriosis, we don't have specific numbers around how it impacts Black women, even though there's more of awareness and urgency, specifically in the States, for us to really look at how Black women are impacted, because for a long time, endometriosis was thought of as a white woman's disease, and we're dispelling that myth. So there's been a call and a cry for us to really look at Black women that do have fibroids and endo, and there tends to be a mixture with Black women having fibroids and also having endometriosis. And I mean, with endometriosis, it's a even more of a challenging disease, because it does take a long time to get diagnosed, because you get diagnosed through surgery, and usually women don't want surgery, and this is across all races. So that becomes even more of a challenge. So again, we really have to look at these populations that tend to have higher risk of chronic ailments across the board, and see, really, how is this impacting their overall health? Reproductive health is part of that as well.
Yes, absolutely.
Wow. Okay. What are some of the treatment options that are available to address some of these challenges, Amoy?
Yeah, so that's a great question. So when it comes to fibroids, for example, there's the conventional method, whether it's surgery or medication, and then there's the non-conventional method around taking. There's an ingredient called EGCG. It's a very long name. I'm not going to try and pronounce it, but basically it's an active ingredient in green tea that can actually help to reduce fibroid growth, because it works specifically on fibroid cells. So that's one agent that a lot of BIPOC folks tend to want. We tend to like to use like natural remedies. Vitamin D supplementation is a big one, which Black women tend to have a lower amount of. And the reason for that is because vitamin D also helps with, at the cellular level, to reduce fibroid growth. So if there's a vitamin D deficiency, then that can actually help to reduce fibroid proliferation. When it comes to endometriosis, it's a little bit more challenging, because the cells of endometriosis can grow outside of the uterus and in other body parts outside of the reproductive organs. It can grow in your stomach, it can grow in your lungs. So it becomes a little bit more challenging to track, especially when it's in its earlier phases. But some of the methods that I mentioned around the EGCG can also help with the lesions, to reduce the lesions. Also, pain management strategies like acupuncture, also seeing a pelvic floor therapist for both conditions can be very helpful, because we know with the lesions for endometriosis, as well as the tumors with fibroids, can impact the strength and the support of the pelvic floor muscles. So seeing a pelvic floor therapist can be very, very helpful to alleviate pain.
Okay, and we're going to talk a little bit about that later on, because that was a new phenomenon to us. So we will talk a little bit about that. But Amoy, you're an agent of social change, and you're out there lobbying, being a voice for women. Can you speak a little bit on a macro level? What can be done to support women of color who are going through these challenges from a macro level?
Yeah, I mean, that's a very big question, because it's, in terms of what can be done, there's a lot that needs to be done in different systems. So, I'll tackle it from like broad, and then I'll get more specific. So what can be done on a broad level is that we need a better systems approach. And what I mean by that is there's a lot of intersection of systems happening. So healthcare system, research, funding. We talked about funding earlier. On a community level, we need to have more conversations like this, so we're aware as to where to go.
Absolutely.
On an individual level, you need to check yourself, because we know with a lot of these issues, women tend to delay when they go and seek help.
Right.
And it's not only seeking help from within your network, you got to kind of break out of your network, because if your network isn't aware, then you're not going to get the information. So there's a lot that needs to be done individually, on a community level, and on a wider level. So macro level is, if I were to go back to the original question, we definitely need more research. We need more data to understand who is being affected, what are their experiences, what are the gaps, how can we close the gaps? So that's one thing. We definitely need more funding for women to actually do this work. That's what I'm advocating for and lobbying for. And on a community level, we need to have more spaces where we can talk about this openly, so that we are aware that there is help available.
Yes.
On an individual level, I think it's important, if someone is going through this, so whether they have, endo, PCOS, uterine fibroids, what are the specific questions to ask? And, myself and my team, we're working on like resources for women that will be coming out soon. But really understanding your disease. So if you're with a physician or a specialist that is not able to explain that to you, finding another physician, and there's different agents that you can use. So there's an agency called the Black Physicians Associations of Ontario. They will help you to find a physician if the one that you're seeing is not up to par.
I'm sorry, what is it called, Amoy?
The Black Physician Association of Ontario. So if you go on to, if you just Google it, it will come up, and that's a great resource that you can use to get connected. And really making sure that your questions are being answered. So, what is the diagnosis? How is this going to impact me down the road? Is it going to impact fertility down the road? And what can I do right now to manage these symptoms?
Yeah.
So yeah, there's a lot that needs to be done.
There's so much.
Yeah. Wow. Amoy, we're blown away by the wealth of information that you have shared with us tonight. And I know from myself, Tam and I, we have learned so much.
Absolutely.
So much. And I'm sure that our viewers are equally enlightened. So Shan and Tam fam, we are not done yet. We will be back next week to speak a little bit more with our beautiful Amoy Jacques, that she will be going more into detail about this very important topic facing women.
And guys, if you have not already done so, subscribe to this channel. And most importantly, share this video with someone you know. We thank you for joining us today. We will see you again next time. Bye.
Bye, guys.
Thanks for watching the show today, Shan Tam fam.
Ensure you hit the subscribe button, like, and share this video.
Send the link to a friend in WhatsApp, Facebook, or even Instagram fam. And of course, don't miss when we post a new video, so hit that notifications button.
Yes. Also, check out the details box for this video for all the links for Shan and Tam's social media